Hi guys, Dr. Eilbra here. Welcome back to the channel. In this video, we will be talking about a common bacterial infection that I see in practice and what you can do to help avoid it, and that is urinary tract infection, simply termed as a UTI. Now, UTI affects 150 million people each year worldwide. It is more commonly seen in women, commonly seen in pregnancy, also diabetic patients, and patients that experience incomplete voidance. Now, there are two common types of urinary tract infections. There's cystitis, and then there's also pyelonephritis. Cystitis is a bacterial infection of the bladder. It's also referred to as a lower urinary tract infection, whereas with pyelonephritis, it's a bacterial infection of the kidneys, and it's also referred to as an upper urinary tract infection. Now, the signs and symptoms for both are quite different. With cystitis, patients experience urgency, frequency, and burning sensation. Also nocturia, which is frequent urination at night, and hematuria, which is blood in the urine. With pyelonephritis, patients experience fever, nausea, vomiting, also a flank pain, which is that discomfort feeling in the upper abdomen, also the sides, and also the back where the kidneys are located. Now, the treatment of choice is quite different for both. With cystitis, the drug of choice is macrobid, which is also referred to as nitrofurantoin. It's dosed at 100 milligrams twice a day for 5 to 7 days, depending on the severity of the urinary tract infection. Keep in mind, macrobid definitely should be taken with food to increase absorption. It is pregnancy category safe, so it's a drug of choice for patients that are pregnant. Another alternative for treatment of cystitis includes Bactrim, which is also referred to as sulfamethoxazole trimethoprim. It's a double-strength tablet dosed twice a day for 3 to 7 days, again, depending on the severity of the urinary tract infection. Another drug of choice would be ciprofloxacin and levofloxacin. Ciprofloxacin is dosed 250 milligrams twice a day for 3 days. And Levaquin or levofloxacin is dosed at 250 milligrams daily for 3 days. Now, keep in mind, Bactrim, Cipro, and Levaquin should not be given to patients that are pregnant. So you definitely want to consult with your doctor if you are allergic to macrobid and you're pregnant. Now, the drug of choice for patients that are on pyelonephritis includes ciprofloxacin and Levaquin, which is also referred to as levofloxacin. Ciprofloxacin is dosed at 500 milligrams twice a day for 7 days, and Levaquin or levofloxacin is dosed at 750 milligrams daily for 5 days. Now, patients that are pregnant and experience pyelonephritis symptoms should be sent to the hospital and given IV Rocephin. Now, in addition to these medications, Pyridium or phenazopyridine, it's also referred to as azo over the counter, is given to patients with urinary tract infections. It's pretty much like an ibuprofen for the pain, and it's dosed at 100 to 200 milligrams 3 times a day for 3 days. Now, a common side effect or symptom of phenazopyridine or azo is a bright orange to a bright yellow coloration of the urine. So patients, when they're taking Pyridium, should be aware that this medication can cause the urine to turn a bright orange to a bright yellow color and should not be alarmed at all. Now, some natural products and tips that you should consider to prevent urinary tract infections is, first and foremost, to increase your water intake. To make sure you're drinking 8 glasses of water every day. Make sure to boost your immune system, incorporate vitamin C rich foods. That includes lots of fruits and vegetables. You can also take vitamin C supplements. Keep in mind that with vitamin C supplements, you can't overdose because vitamin C is a water-soluble vitamin and it does get excreted out of the body through urination. So there's no max limit to vitamin C tablets. You can also try my favorite tea, and that includes ginger, turmeric, a little bit of honey, and lemon inside of your tea. So what you're gonna do is take half an inch of ginger, half a teaspoonful of the turmeric, half a teaspoonful of honey, and a squeeze of lemon into your tea. Stir the mixture and drink it before your meals or even after meals. So make sure you go ahead and try to incorporate this tea. Let me know what your thoughts are down in the comment section below. Thanks, and we'll see you in the next video.